We're back with Our Aging World here on WINT, 1330 AM. My name is Joey Tomsick. I'm with you from the Lake County Council on Aging. We're so happy that you have decided to join us today during our Good Afternoon magazine of the airwaves. And we remind you that our show comes your way each and every Wednesday afternoon at this time. We also do a rebroadcast on Saturday afternoons, and you can always catch our archived shows. If you thought, oh, what are they talking about on that segment? You can tune in the middle of the night even and go check it out and re-listen to one of our programs. We have a very exciting program, a couple portions here coming up in this final portion of our program today. I'm so thrilled that Dr. Sonia Stiller has joined us today. She is with the Center for Advanced Vein Care right here in Mentor, Ohio. And Dr. Stiller, we're going to be talking about varicose veins, right?
Exactly. Hi, it's very good to be here.
Well, we're thrilled to have you. Council on Aging was involved with the big senior day out at the Lake County Fair this summer, and that's where we got to meet you
That's
and
right.
find out about your clinic and some of the good treatments that are available out there. I'll tell you what, varicose veins, I think psychologically, affect people, physically affect people, and this is going to be a great learning curve for a lot of our, not only myself, but a lot of our listeners today.
Right, exactly. I think one of the most commonly misunderstood medical disorders out there is varicose veins and vein disease. For so long, it's been thought of as really a cosmetic problem. So people tend to wear long pants or long dresses in the middle of the summertime when it's really hot. Right. If you're hot already, the last thing you want to do is wear a long pair of jeans. But when these veins are either just prominent and bulging out like those spidery, or the spidery veins, the red ones on the side of the legs, or the big bulgy ropey veins, when they're there, people don't always want to show their legs, and instead of talking to a physician about it and seeing what can be done, they're often pushed to the side and said that, listen, it's just cosmetic, it's not impacting anything, so, live with it. So they tend to try to hide it. And the reality is that varicose veins can cause a lot of problems, and over the long run, it can affect so many portions of your life, including just simply walking. So it's definitely something that's misunderstood, and we need to delve a little bit more into what's going on with vein disease to get the best treatment possible.
So let's just start right at the very beginning. What are some of the symptoms of vein disease? I guess is that what you would call it, or vein problems?
It's funny. Most people, when they come in and I say that they've got varicose vein disease, the first thing that they say is, disease?
Yeah,
I've got a disease? This isn't a disease. This is just ugly-looking veins. Yeah. The reality is what's happening when you've got varicose veins is that these veins are broken. Now, when I say broken, they're not bursting open and bleeding, and they're not causing a lot of bruising or something like that. Instead, what's happening is they're losing their normal function. So the job of your veins is basically to carry all of our used blood back into our body. Our heart pumps our healthy blood out to the body through the arteries. So the blood that goes out to our body has all the oxygen, the vitamins, the nutrients, everything that we need for metabolism. When your body uses what it needs, it then dumps its trash into the veins. So that trash includes lactic acid, other acidic components of metabolism, less oxygen, because you've just used all of that. So that blood now is sitting inside our veins. Well, in order for that blood to recirculate, that blood has to get back to our heart. Well, in our legs, that blood has to travel against gravity from the bottom of our feet all the way up, almost 3 feet to get to our heart. Mm-hmm. Well, how the heck is that going to happen?
Right.
We need two things functioning normally for that to work. Number one, we need a pump. That pump is your calf muscle. So your calf muscle is the heart for the veins in your legs. So the number one most important thing, and we'll talk about this later, I'm sure, is to keep that calf muscle pump strong. When that calf muscle pumps, with every movement of our leg or our calf, blood is drawn in from the vessels on the surface into our medium and larger vessels, ultimately into the large vessel. So it's kind of like a tree branch. The small spider veins you see on the surface are like the little leaves in the small branches, right? Mm-hmm. And they dump into medium and larger branches, ultimately to the trunk vein, which is our deep vein system. That deep vein is what carries our blood up. Well, in between steps, or if we're sitting or standing, and that calf muscle pump isn't functioning, right, that blood tries to fall back down because of gravity, right? So to keep that from happening, we have valves inside these vessels. And they're one-way valves. I always like to use my hands, so it's really hard to kind of describe this.
Especially on radio.
Exactly.
Yes.
But basically what's happening, they're one-way valves. So when the blood flows in, the valves open, the blood will flow in and up. And then when the blood starts falling backwards because of gravity, it stops at these valves. So it keeps it from falling all the way back down to our feet like it wants to do because of gravity. Well, that's how it's supposed to work. Every time that calf muscle contracts, blood moves in and up, and then it stops at a valve and waits for the next contraction to move up, kind of like a lock system. Okay?
Right.
Well, when the veins break, that's what we were talking about, broken veins. What's happening is the veins start getting big. So those big ropey veins, or the veins we're starting to see, the vessel walls are starting to stretch. Well, when that happens, those valves are attached to the walls. So as the walls pull apart, the valves are pulled apart. So now when that calf muscle pumps, the blood still goes the right direction. It goes up. But as soon as you stop moving that calf muscle, it starts falling back. And instead of stopping at that valve, now it's leaking past. It eventually will hit a normal valve. Over time, that one's going to break. So it's like kind of like a domino effect. With every valve breaking, it puts more pressure on the next one, and it keeps breaking all the way down. So when we're dealing with a disease process, what's happening is it's something that isn't a one-time thing. It's a continuously worsening process, and that's what's happening with varicose veins as well.
So when a person starts to see a little bit of the, the spider veins, the markings, is that the symptom that triggers them to know, this disease could be happening? Or, I mean, what are the symptoms?
Right. Well, the symptoms are a little different. When you see spider veins, that can very well be kind of like the tip of an iceberg. All right. When you see a spider vein, it's the part that's showing on the surface, but it can be telling you that there's more going on underneath. That still is an appearance. It's something that we see. It isn't necessarily something that we feel. So when we talk about symptoms, those symptoms are more the sensations that we're feeling associated with the disease process. Some of those symptoms can include things like achy, painful legs. Now, we tend to blame that on a lot of other things, like what we've done during the course of our day. But if you notice that your legs are getting more painful and more achy towards the end of the day in particular, or if you've been standing for a while or sitting for a while, both of those things are things that increase the effect of gravity on our legs, right? Then it may very well be related to veins. Other symptoms can be heaviness or tiredness, fatigue, that feeling like I just don't want to walk up another flight of stairs, or I come home from work, I sit down, and I just have to put my feet up because it makes such a big difference.
Okay, now this is starting to sound a lot like what we just had one of our guests on the Arthritis Foundation, where a person feels fatigued. They just don't want to do anything, or maybe they've been working in the garden So is there a correlation, or sometimes people think they have arthritis, but it's the vein disease?
Absolutely. Absolutely. A lot of the symptoms that go along with varicose veins also are associated with other disease processes. And another interesting thing is because the process that's happening with varicose veins is an inflammatory process. Something has broken. And anytime something in your body breaks, you get an inflammation. So with arthritis, it's not a truly broken part, but it's an inflamed joint. Well, with veins that are inflamed, if they're sitting anywhere near that joint, you're going to start noticing increased inflammation. And they basically play together. So it's almost a double sensation.
Right.
Yeah.
Right.
So if you have achy, painful legs, it may be arthritis. It may be some other process going on, but it also may be the veins. And sometimes as you treat the veins, other symptoms or those symptoms will improve even if you've got another process going on. So.
Or it might be you were just dancing the funky chicken too much last night. Right?
I don't ever do that, no.
Okay. So is there one segment of our population who is at risk for developing vein problems more than another segment?
Well, varicose veins and vein disease is predominantly hereditary. So about 95% of the time we can blame it on somebody else, our mom, our dad, grandma, grandpa, aunts and uncles. And remember, if they wore long pants and you never got to see their legs, there's a possibility that they may have had varicose veins and they just weren't showing them. So often it's hereditary. But as there are several other factors that play a role in the development of varicose veins. So, for example, women have the hereditary component, but they can also have hormonal changes, and that's cumulative over the years. So even when their cycles are all done and there's no longer that hormonal change, that has added up over the years, and then for every pregnancy they're at higher risk. Aging is a big key. Over the age of 50, 40 to 50% of Americans, both males and females, have some aspect of vein disease that are playing a role in their symptoms.
Wow.
Yeah.
We're speaking with Dr. Sonia Stiller, who joins us today, and we're talking about varicose veins. She is with the Center for Advanced Vein Care. When we come back, we're going to talk a little bit about treatment options, perhaps medications, that type of thing, and more about the center as well, okay? So,
sounds good.
All right. Thank you for tuning in. There's more to come here on Our Aging World on Integrity Radio, WINT, 1330 AM.
Will you still need me? Will you still feed me when I'm 64?
Pat O'Brien Chevrolet is Ohio's #1 Chevy retailer, which means we sell more new Chevys than anybody. That means we take in more fresh trades, over 1,000 used vehicles, all makes and models, sale price to move out immediately. Save time and money at Pat O'Brien Chevrolet.
Try to define homey, and you may stumble with the words, but you know it when you feel it. And the one word that residents of Governor's Port Independent Living in Menor agree defines their home is homey. Of course, they also love the spacious apartments with full-size kitchens and friendly atmosphere, with neighbors and staff that treat you like family. Discover homey living. Call Governor's Port and ask for your personal tour with Yolanda or Colleen, 440-255-3030.
Hi, this is Lake County Sheriff Dan Dunlap. This November, I'll be voting to retain Judge Mark Bartolotta for Lake County Probate Court. I've known Judge Bartolotta for over 20 years, first as a longtime major felony prosecutor in Lake County, and now as probate judge. The Lake County Bar Association rated him as highly recommended, the only one to earn the highest endorsement in the probate court race. Judge Bartolotta has been protecting our Lake County families for over 21 years. Vote to retain Judge Mark Bartolotta for probate court. Pete's West means to retain Judge Mark Bartolotta, John Redmond, Treasurer.
Pat O'Brien Chevrolet is Ohio's #1 Chevy retailer, which means we sell more new Chevys than anybody. That means we take in more fresh trades, over 1,000 used vehicles, all makes and models, sale price to move out immediately. Save time and money at Pat O'Brien Chevrolet.
Smell the aroma at Dickey's in Menor, where the brisket, pulled pork, and ribs are seasoned and slow smoked over a hickory wood fire. Home style. Classic sides are served with a kick, and top it off with free ice cream all day, every day. Sundays, kids 12 and under eat free. Dickey's, just east of Heisley Road on Menor Avenue, is the answer to your catering quandary. Graduation parties or backyard blowouts. Let Dickey's cook it up, Texas style.
I'm Steve Newman. Here at Integrity Radio, you know we check out our advertisers. The BBB rates this company A+. And since I start my days really early, getting a good night's sleep is critical for me. Over 3 million people sleep on a MyPillow, and every MyPillow is made in the USA. I like that. Every MyPillow has a 60-day money-back guarantee and a 10-year product warranty. You wash them and dry them like you do your favorite pair of blue jeans, and they never go flat. They stay cool all night long, and you don't need to wrap your arm around your pillow and have it fall asleep before you do. And after you select the right MyPillow for your particular sleep style, it still adjusts to you. If you have special conditions like migraines, insomnia, snoring, fibromyalgia, restless leg syndrome, TMJ, even allergies or asthma, you absolutely must give MyPillow a try. People with these conditions say it really helps them. You're gonna love it. Please visit MyPillow.com and enter promo code WINT to save money on every purchase. That's MyPillow.com or call 800-324-0652. Wake up tomorrow morning at 7 a.m. with Mike and Rob and guest HGTV Design Star finalist Daniel Grady Fairs. Dr. Linda Fu of Children's National Health System talks vaccines, plus the News Herald's Mark Mazzoros on Integrity Radio, WINT 1330 a.m. and WINTradio.com.
Back with our final portion here of Our Aging World here on WINT 1330 AM. This is Joey Tomsick with you from the Lake County Council on Aging. We are thrilled to have Dr. Sonia Stiller, who is joining us from the Center for Advanced Vein Care. Where is the center located?
It's at 7200 Mentor Avenue, so right near South Point Plaza at 306 and Route 20. There's a GFS, and we're right next to that GFS. And it used to be an old carpet building.
And actually, I think many of the folks listening probably received in their mail just last week a circular that has a pretty interesting interview and description of the center.
Right. We were in the Mimi magazine on the cover and did an article in there that I think provides some pretty good information about varicose veins and symptoms that you should be looking for to consider coming in for an evaluation. We do have free screenings going on right now, too.
Oh, really?
Yeah. So if you're concerned or you're thinking, hey, maybe my swelling is related to veins, but you're not certain, then please just give us a call, come on in, and we can take a quick screen to see if that's part of the issue.
So really, don't be afraid to make that call.
No, absolutely not.
What is a good phone number for folks to reach you?
All right. Our phone number is 440-710-1140.
So, Dr. Stiller, do you really have to take more medication to get leg swelling under control?
That's an interesting question because often I will get referral doctors sending in patients because they've just added another diuretic or water pill to help control the swelling. And oftentimes what's happening is the patient has venous insufficiency, which is when the veins are broken and the blood's flowing the wrong direction. That the inflammation caused by all that trash in that vein can cause swelling. So oftentimes if we get that venous insufficiency under control, we actually can eliminate not just one, but sometimes you can get rid of all of the diuretics or at least one of them. The idea, of course, is we don't want more medications. We want to try to get rid of the cause of the problem. And if we can do that and eliminate medications, it's ideal. It doesn't mean we'll be able to get rid of all of it, but it does sometimes help quite a bit.
Is there a correlation, too, to what they call the restless leg syndrome?
Yes, absolutely.
So people go to sleep, right, and they can't sleep because those legs are just like, they want to keep going.
They feel like their legs have to keep moving, or like sometimes I'll get the description that there's bugs crawling under the skin, or that sensation of something just making you feel like you have to move your legs. And, restless legs can be so disturbing. It interrupts sleep. It makes it difficult to fall asleep, makes it difficult to stay awake or stay asleep. You tend to wake up in the middle of the night. And the fact is that often restless legs and vein disease are correlated. If you have varicose veins and you have restless leg syndrome, you need to treat those varicose veins because treating them alone can get you off medications and get you a better night's sleep.
Wow. And let's talk about treatment. What are some of the treatment options for vein problems? If you could comment a little bit about that.
Absolutely. There's actually a spectrum of treatment out there. We can start with things that are fairly simple. Exercises to strengthen the calf muscle are key.
Oh, yes.
So
you started out, you told us that calf muscle has to be...
Keep moving. Keep that calf muscle moving.
It's like the heart.
Exactly. And what you have to understand is as soon as you stop moving, as soon as you stop walking, all of your other health issues start kicking in. So we've got to keep you moving. So if you come in and you're not moving that much, one of the first things I'm going to do is start teaching you some calf muscle exercises to strengthen that calf muscle. Walking is very important. You don't need to do anything more extensive than that. Even just a simple walk around the block several times a day is really very good. So exercising your legs is key, and I'm going to push that. Wow. The other thing is wearing compression. Now, compression doesn't have to be your grandma's stockings anymore. I mean, it used to be that we talk about grandma's peg legs with those nasty stockings, right? Or, and we still use those stockings because when we're doing treatments, we often need to have the tight ones, and nobody wants to wear those all the time. But the fact is I wear compression stockings on a regular basis, and I'm a professional, and I want to look good. So there are so many different styles, from tie-dye stockings to sheer, different color stockings to black. They have sports socks that look like you were just going to the gym, and they're exercise socks. So we're not stuck with that same old grandma stocking anymore. But wearing compression is really important. I just recently put my mother on compression stockings because she has leg cramps. And wearing the compression stockings alone during the course of the day has significantly improved the leg cramps. So, and I hear that all the time. Now, if we want to move on with further treatment, then we do an evaluation to look at exactly where the problem in the veins is, because it can be in a lot of different areas.
So I'm going to stop and just put the pause button on right there because I think a lot of people listening are surprised that the first words out of your mouth was not about surgery. You're talking about exercise. You're talking about compression stockings, all these other things that really do matter and that really could help.
That is so very important.
So you'll take a look at all those items first.
Absolutely. And, and if we get to the point where we've done exercises and your compression stockings are working and you don't need anything else, that's good. Then that's all we need to do. For some people, they're happy with just doing that. If we want to move on, we certainly can, and there are so many different options. It used to be that the only treatment for varicose veins was stripping surgery, where literally we would go in, do surgery, and pull them out. And for so many reasons, it's a very difficult procedure to deal with. So now we do some minimally invasive procedures where you're in without a hospitalization. You come into the office. Everything is done with a needle, so it's not incisions and it's not a long recovery time. And you're up and moving immediately afterwards. There's laser treatments, heat ablation, sclerotherapy, a lot of options which we can talk about in more detail if we wanted to go into that.
Dr. Sonia Stiller, you mentioned a little bit earlier you're having free screenings this month.
This month into next month as well.
Okay, and if someone thinks that they may have a vein problem, but they don't know for sure, can they just kind of pop in?
Absolutely. You can stop by the office
again. Like the veins pop out?
Exactly.
Have them pop in?
We'd rather them pop in.
Yes.
And we're located at 7200 Mentor Avenue. Our phone number is 440-710-1140. Or you could check us out online. There's a lot more information at our website, and that's yourhealthyveins.com.
Wow, very good. Dr. Stiller, I sure appreciate you coming today and filling us in on this subject.
Absolutely.
Maybe we can get you back and maybe do some live calls, that type of thing, and some future show.
That would be excellent. I'd be happy to.
All right, perfect. You've been listening to Our Aging World here on WINT. This is Joey Tomsic with you from the Lake County Council on Aging.